everyone, my name is Dr. Annicka Golding. I'm an audiologist here at Advanced Specialty Care. Recently, there has been a lot of conversations and studies surrounding the connection between dementia and hearing loss. As patients become more aware of the possible connection between hearing loss and cognitive decline, a multitude of questions have been raised during my appointments. This video will discuss two of these questions. Number one, is there a link between hearing loss and cognitive decline? Yes. One study performed by Johns Hopkins researcher Dr. Franklin and his colleagues monitored 639 adults over a 10-year period. The results of this longitudinal study revealed mild hearing loss doubles a person's risk of dementia, moderate hearing loss triples it, and those with severe hearing impairments have 5 times the risk. The exact cause of this cognitive decline is not yet well understood. However, researchers have several theories. The first theory refers to cognitive load. It theorizes that untreated hearing loss causes the brain to constantly strain to detect and understand speech. This results in the brain becoming overworked and not functioning as effectively. The second theory refers to the brain's anatomy. Brain cells can shrink due to lack of stimulation, impacting sections of the brain that receive and process speech and other sounds. I often tell patients to think of sound as food for the brain. If you're not stimulating the brain the way that you should, some of these neural pathways used for language reception and reception abilities can lose function over time. The third theory is social isolation. Hearing difficulties can result in social withdrawal, which can lead to less information and stimuli reaching the brain. You may be wondering, what can I do? Audiologists strongly recommend patients first undergo a hearing examination. This examination will help determine a patient's current hearing status, the presence of any hearing loss, and will be used to detect changes to hearing over time. It is recommended that patients undergo a hearing examination every year, similar to other checkups. If a hearing loss is identified, as audiologists, we strongly recommend patients receive hearing aids as soon as they are ready and able. Researchers found that for subjects at higher risk for dementia with conditions like type 2 diabetes and hypertension, using a hearing aid cut their cognitive decline by nearly 50%. Hearing aids received from an audiologist such as myself at Advanced Specialty Care are programmed specifically to the patient's hearing loss, lifestyle, and listening needs. Our doctors of audiology work with our patients to develop and execute the best care for your hearing that is as unique as you are. So schedule your annual hearing examination today with the Doctor of Audiology at Advanced Specialty Care. It will be our pleasure to work with you.